Assalamu alaikum. So I'm here with my new lecture, a very important lecture from OSCE point of view, which is sexual assault. So today we will discuss how to manage a patient with sexual assault. So we will discuss according to the particular scenario given as how to manage a patient and how to explain it to the examiner in the OSCEs. Okay, so few statistics that 35% of women worldwide have experienced physical and sexual intimate partner and non-partner violence. One quarter of women have genital injuries following sexual assault, and the remaining of them have injuries on other body parts rather than the genital areas. Okay, so during OSCEs, uh, question paper is given to the candidates or it is pasted on the table there, in which a scenario is written, and the examiner has to assess these things which are mentioned here, and they are how the candidate gather the information from the patient or the simulant who will be sitting there, communication with colleagues if any other person is called to sit there, how student is communicating with them, applied clinical knowledge, what knowledge they have regarding the particular topic that is given during the OSCE station in examination, and how safe they are with their patients. So these are the four criterias on which the markings are given during examinations, whether it is MRCOG exams or FCPS exam. The criteria is same for both of them. So here is the scenario. You are R4 resident on call. You have been called to emergency room as your R1 has received a 25-year-old woman with complaint of sexual assault. You are expected to obtain targeted clinical information and examine the genitals of woman. Okay, so this is the particular scenario, and now we will discuss that how you have to approach that woman regarding her history and the examination and every important measure which you have to take. So the key points for this station is you have to take relevant history, examine the patient, early evidence kit. What is this? We will be discussing in the upcoming slides. How much forensic people will be involved and what evidence they have to collect. Emergency management of serious injuries. Minor injuries should not be cleaned initially as samples can be taken from them. Okay, so if any injury a woman has which is bleeding, or she has some kind of deep or serious injuries, they have to be immediately managed. But other injuries that are minor lacerations, they should not be touched or nothing should be done of them. Advice of emergency contraception, prevention of sexually transmitted infections, and post-exposure prophylaxis of HIV. Ensure her safety before going home. Support groups and contact numbers. So these are the key points for this station. This all you have to do stepwise in your counseling or whatever, in whatever manner you get this station, you have to follow these key points. So detailed history. What to ask in the history? You have to ask regarding the time and place of incident, nature of event, like whoever person has done this, either he was alcoholized or he was a drug addict. So drugs or alcohols were used to facilitate assault, and this has become a common practice nowadays as well. So you have to ask regarding the nature of event, that what was the condition of the person who has committed this thing at that time, what happened, where and with whom, what exactly has happened, and what was the place and who has done this. Either it is a domestic violence case, it is a sexual assault or rape in between a married couple, or it was someone else. So you have to exactly ask what has happened. Record notes in her own words. This is very important. You have to write each and every word according to what woman has said. Make sure notes are accurate. Be non-judgmental. You cannot impose anything on her. You have to just listen and write whatever words she is using. You have to be non-judgmental at that time, because that is an empathetic attitude which you have to adopt during such sensitive situations or sensitive scenarios if you have given during examinations or even in real life practice. Believe the complainants. So you have to believe whatever she is saying, and write and record accordingly. Okay, so in examination you have to look for the location of injuries. You have to note the shape of the injuries, the color, like how old or fresh the wound is, size of the injury. You have to measure the size using a measuring tape. The type of injury, that is either it is a laceration, it is an abrasion, or it is a deep wound. Pain, whether it is painful or not, tender or not. So if woman permits to have forensic evidence collected, if she permits that yes, you can take the forensic evidence, or you can take the samples, because there are few women who just say no to these things, and they do not want to get themselves exposed, or any other problem she could have. So if she permits to have forensic evidence, you do not have to you should ask the woman that she should not wash or wipe, eat or drink or pass urine after the assault. Means if she has this in her mind that forensic evidence should have to be taken and sampling could be done, so she should not wash or wipe anything after rape or assault, eat or drink or pass urine. Contact the police or sexual assault referral center, which is SARC, to discuss an early evidence kit. So what is early evidence kit? In early evidence kit there are certain sampling bottles and tubes. It has a urine collection pot. Why urine has to be collected? Because it has to be collected to assess drugs, alcohol used during sexual assault. So urine would be collected from the woman. Mouth rinse if oral penetration is suspected. If she gives a certain history of oral sexual activity, so a mouth rinse has to be used. Mouth swab should have to be taken, and toilet paper sample from the anal area. Okay, so this is the evidence kit. It has that this urine collecting bottle, it has vulval gauze wipe, perianal wipe, oral rinse, and these are the certain wipes and the toilet papers, and it has sampling kits. So this is the early evidence kit. It comes in a cardboard with all these things available in it. Okay, a very important thing which you have to ask the patient and counsel her accordingly. First, you have to ask regarding her menstrual date and whether any barrier contraception is used during the assault or not. Might be she would not know about that, but you have to ask during your history taking. This would you would get points for this. And okay, so the risk of pregnancy following vaginal rape is 5%. It can carry psychological and physical complications, which we all know. Try to inquire the timing of menstrual cycle. So are these are her ovulation days, or she has just finished her cycle? Whatever, you have to ask regarding the timing of her menstrual cycle. Offer emergency contraception. So what emergency contraceptions you can offer? You can offer copper intrauterine device contraception, which can be given within 5 days of unprotected sexual intercourse, or within 5 days of earlier estimated date of ovulation, whichever is later. So you can prescribe this. Offer oral emergency contraception if intrauterine device is not acceptable. So what oral emergency contraception we have? We have that levonorgestrel tablets, emergency contraception tablets, or we have ulipristal acetate. So ulipristal acetate is more effective than levonorgestrel intrauterine system if used within 120 hours of unprotected sexual intercourse. So these are the form of emergency contraception which you should know, because examiner can ask regarding it. And the timing of prescribing emergency contraception, it would be according to the timing of her menstrual cycle. So what immediate care and follow-up you have to do? You have to manage for sexually transmitted infections. This also, if the examiner asks you that what management you will do of this woman, then you will tell that HIV post-exposure prophylaxis, which is known as PEPs, start within 72 hours and continue for 4 weeks. Offer accelerated course of hepatitis B vaccine, which I will discuss in this line. Offer referral to sexual health clinic. Screening 2 to 3 weeks after assault. You have to screen the woman with the vulval swabs and vaginal swabs, and you have to send the cultures after 3 weeks, because this is the incubation time period of all the pathogens, and blood samples as well. Neisseria gonorrhea, chlamydia and trachomatis swab which are sampled via nucleic acid amplification test. They should be taken from site of assault. The site could be pharynx, vagina, anus. That means oral sexual assault, or perineal or anal assault. Blood test at 3 months for hepatitis B, syphilis and HIV. So you have to take the blood test after 3 months. Hepatitis B vaccine you have to offer, and this can be given at 0, 1 or 3 weeks, or 0, 1 and 2 months, with boosters in both of these courses at 12 months, whichever is acceptable for the woman. So this is a very important slide regarding the management of sexually transmitted infections. Okay, so what are the vulnerable groups? The vulnerable groups are those who are they have some kind of mental instabilities. They could be young girls, divorced women, socially deprived, poor women, transgenders. And you have to assess GILIC competency in below 16 and 18 years of age. Like, you have to assess whether this person is mentally compatible or competent enough to assess and answer your questions, or to give any suggestions regarding emergency contraceptions, or does she even understand the whole scenario which has been happened with her. So for these women, you have to consider referral to the drugs and alcohol services. You can refer them to mental health services, child and adult safeguarding services. Multi-agency risk assessment conferences are done for them. In these conferences, the upcoming policies are discussed, and they are very confidential conferences in which all the condition of the woman, her circumstances, and the upcoming strategies for her are discussed. When children and others are at risk, police can be informed without woman's consent. So this is very important. If that woman deny to inform anyone or to involve any legal authorities, but still she has children or other adults at her home which are at risk by that particular person, so you can involve police without her consent. The ongoing follow-up would be by providing aid to that woman. You have to provide her refugee if she does not have any other place to live, and you have to assess for post-traumatic stress disorder. This is very important because there is a kind of depression, anxiety and hallucinations and night flashes in front of all these women who have gone through this traumas. And you have to obtain blood tests in the follow-ups, like I have already explained. After 3 months you have to take blood samples for hepatitis B, and you have to take the cultures. Check for medications, whatever you have prescribed that woman, like you have given post-exposure HIV prophylaxis, you have to check for medications whether she has taken or not, and you have to follow up for vaccination and the booster doses as well during the follow-up. Okay, so the clinical and forensic criteria of diagram. Whoever person has examined that woman, he or she has to draw the diagram of the particular injuries of that area where the injuries are present. Each injury should be described in clinical notes, including shape, depth, color, and tenderness. Type of that injury, like it is a bruise, it is abrasion, it is laceration. Make a careful description. You have to write whatever is seen. Use a body diagram. Measure the size of injury using tape and explain it using anatomical landmarks, like bruise is present just above the elbow, so you have to mention it like 5 centimeter of bruise is present just above, it is present 2 centimeter above the elbow, so you have to explain it accordingly according to the anatomical landmarks. Mention date and time of each body diagram as well as name of person examining. Written consent is necessary for photographic evidence. Digital cameras can be used and genital injuries can be photographed using a colposcope. So in this thing, forensic people will be involved, and they will bring their own digital camera peoples, and they will take the photographs, but this all can be done after the consent is given. So thank you so much for my today's lecture. This is a very important station from OSCE point of view, and this will be helpful for the candidates who are preparing for the examinations, OSCE examinations especially. Jazakallah.